Shortly after Valentine's Day in February, I met with the governor's staff and specifically asked for a plan for phase 3. Here we are in March and no plan is forthcoming. So as Senator Braun said, we went ahead and we made our own plan because the people of Washington deserve to know. We abandoned the regional plan because we experienced firsthand how that was a failure when a small recording error held an entire region hostage in phase 1 until local county officials recognized the error. No one knows a county better than the people that live there. They knew that something wasn't right in the reports and they pointed that out. That's why our own plan, Open Safe, Open Now, returns control to the counties. Under our plan, all counties go to phase 3 immediately. Our COVID numbers have been in free fall. There is no reason not to move us all into phase 3. Phase 3 means effective immediately. All students return to the classroom. Hospitality returns to 50%. State parks and tourism resumes at 50%. Indoor weddings and religious services and events are at 50%, and professional services are at 50%. After 3 weeks, all counties move to phase 4, which means everything opens at 100%. If a county determines it's not prepared to move forward, it will say why, and it will provide a plan with regard to move forward. I trust the people of Washington to demonstrate personal responsibility and do what is necessary to get children back in school, people back to work, and our businesses reopened completely. So I say, listen to the people, open safe, and open now.
I think it's important to acknowledge COVID in our state has been serious. We recently passed a somber mark, 5,000 deaths related to COVID. And we are not proposing that we ignore that at all. But we're also proposing that we pay attention to all of the costs that we've paid and are continuing to pay clear across Washington in our reaction to COVID. There's hardly a person I know who doesn't know a young person who's gone backwards, sometimes in tragic ways because of the isolation that's been imposed on them. And I think almost everybody is aware of older parents or grandparents who are suffering. I know of one that I'm quite close to, one set that I feel like have aged 10 years. And the price is high. And it's absolutely critical that we pay attention to that price at the same time as we pay attention to the price that we've paid for COVID. I'm sure that the governor is going to respond to this somewhat like the president recently did in some states. But we need to be responsible. We need to recognize the costs on both sides of this equation. And I'm proud of the House and Senate Republicans who are working hard on this. And I'd like to ask my trusted longtime associate, Joe Schmidt, to add to this.
Well, there are costs to this, and they're not all financial. There's human costs to this. Yes, we've crossed the barrier of over 5,000 deaths. But as I talk to others, we're seeing a lot of mental health delivery, either through the Medicaid or private carriers, is at an all-time high. We've seen an unusual high number of suicides. There's a cost to staying where we're at. So do we advocate safely? Yes. Masks, wash your hands, social distance when possible. But we've been doing this for a year. We can move ahead. We know how to do it safely. I want to put the trust in the people to be able to protect themselves. And just one other thing, we can allow our local health departments to make a lot of these decisions locally. They know better in their county than anybody else. Nobody from Olympian knows it better than our local health departments and their jurisdictions. They need to be involved with this decision process. So I appreciate being able to throw my 2 bits in. Thank you.